It's one of the most sought-after professions in healthcare today, and statistics show that since May 2010, approximately 81,000 people are actively working in this field. Physician assistants are a rapidly growing segment of the medical community. Working alongside doctors, physician assistants, more commonly known as PAs, are an integral part of patient care and can be found in every medical specialty.
We interact with the patients in the office, in the hospital, in whatever setting it is. We do their histories, physicals, prescribe medications for them, do discharge summaries in the hospital. We work with the physician in the operating room, and we work as part of the team.
There is very little difference between the way a doctor and a physician assistant treat patients. Because they are educated under the same model and practice as a member of a physician-directed team, PAs are able to perform the majority of the same duties as doctors, helping alleviate physicians' intense workloads. The team-based approach is essential in providing both preventive guidance and quality patient-centered care.
As a physician assistant working in cardiac surgery, I assist the surgeons in the operating room for a heart bypass surgery. As a physician assistant, I harvest the vein out of the leg that we use for the heart bypass operation. If it's a valve operation, I assist the surgeon in replacing the valve. I then take care of the patient in the intensive care unit for the first few hours after heart surgery all the way to discharge.
Because of the heavy physician workload, it is often easier to make an appointment with a PA.
The number of patients that every provider is expected or required to see during the day has increased tremendously. I know that PAs allow for better access to patient care, acute care, illnesses, follow-ups on chronic disease. I just think the need is there and it's going to continue to grow.
As a physician assistant, I am able to spend more time with the patient. If my surgeon is in the operating room for the day, I am able to meet with the patient and their family as they recover from heart surgery, to explain the complexities of recovering from heart surgery, to go over disease management prevention, and to help with the discharge process.
In my practice, PAs are absolutely indispensable. It's like that in cardiac surgery throughout most of the country, but here at Geisinger specifically, we depend on PAs not only for their technical expertise, but because they are in many ways the glue that binds together the entire service. They serve as almost our detectives, almost the canaries in the mine. They are on site taking care of patients so frequently and in such an intimate way that they are sensitive to subtle changes in patients' conditions well before the physicians and other folks ever recognize it.
As key members of the medical team, physician assistants are helping to raise the standard of care across the rapidly changing healthcare landscape.
I think having a national organization such as the AAPA is extremely important. They are aware of all the changes that are going on and all the changes that are necessary. And I know that as I'm doing my day-to-day activity, they're behind the scenes working for a total PA profession to help keep us going and improve the work that we can do.
The American Academy of Physician Assistants is the only national professional association that represents all PAs across all medical and surgical specialties throughout the country. AAPA works to support this rapidly growing field by offering career guidance and advocacy support to ensure that PAs can practice to the fullest level of their education and training and provide patients access to high-quality, cost-effective health care.
The AAPA, or the American Academy of Physician Assistants, helps PAs keep up with this growth through continuing medical education, providing seminars, providing information on a regular basis to help the physician assistant stay updated. We also have several different groups inside of the Academy that help us to keep up. We have advocacy, we have reimbursement, and other things that help with not only the practice development, but also the professional development of the physician assistant.
PAs need to stay in touch with the constantly changing medical landscape. That's why AAPA provides easy access to continuing education through regional and national conferences and connects you with other PAs and experts in almost every medical specialty. AAPA is dedicated to fostering an environment of professional and leadership excellence.
We have a leadership commission that works on developing programs for people who are interested in being leaders, not only on the national level, but on the local level as well. There are commissions and work groups that PAs can be involved in that allow them to learn how to be leaders, and for those people who are already well versed in leadership, it also gives them an avenue or a vehicle that helps them to grow.
The AAPA has remained my primary source to keep me up to date with modern medicine with regards to managing the best way to manage diabetes, hypertension, thyroid disorder, all of these things that can affect our patients on an everyday basis.
Becoming a member also gives you a voice in policymaking, as AAPA is a staunch advocate for legislative changes that affect the future of all PAs.
Recently, the Academy has been involved in creating a position within the Veterans Administration that is entitled the Director of Physician Assistant Services. This is a very important victory for the PAs who work within the Veterans Administration because it now will give them a voice in deciding policy and the health care that is being given to the patients that they take care of. The Veterans Administration is the largest employer of PAs in the country. The mission of the AAPA is to enhance the personal and professional growth of physician assistants. It is to provide the resources and tools that PAs need in order to provide high quality, cost-effective, patient-centered care.
The momentum behind this field is palpable, and the American Academy of Physician Assistants is leading the way to connecting PAs and transforming care. For more information, log on to aapa.org.